My name is Natalie Bownes. I'm a resident of downtown and a registered nurse. My husband grew up in Windsor, and he and I chose to move back here from Alberta in 2008 to start our family. My in-laws live here in the West End, and I am proud to call myself a new Windsorite. When we moved here, we chose to live downtown so I could walk to work. I worked at the Hotel Dieu Grace Hospital in the emergency department, which is now the Olette site of Windsor Regional Hospital. We bought our house downtown and now have 2 children, ages 3 and 5. 5 years ago, we also moved my mother to Windsor from BC to live with us. At 68 years of age, she has many health concerns, and the downtown location of our home makes her complex health needs much easier for us to navigate. The ability to live in a walkable community where we don't always have to rely on cars is important to us. This is especially true for my mother, who can no longer drive. Every hospital where I have worked in my 18-year career in healthcare was the heart of the town or city or neighborhood in which it was in. Whether it was in rural Alberta, Edmonton, or Melbourne, Australia, it was accessible to the people who lived there by more than just cars. I could walk, cycle, or take the light rail train in Edmonton or the tram in Melbourne. Actually, active transportation was preferable, since in the urban centers, the hospitals were located in such densely populated neighborhoods that parking was expensive. People are always coming and going from hospitals, and they support the neighboring businesses. If the hospital was built in a brownfield site, this is the type of effect we could achieve, and a tax levy would be justified. On the other hand, if we proceed with the tax levy to fund a hospital on County Road 42, we will miss a historic opportunity to intensify development within the core of the city, and we will almost certainly exacerbate the urban sprawl that the city currently suffers from. The health of the community and workplace wellness is also a concern for me and many area employers, as it should be. Ensuring that healthcare workers have healthy options to get to work, such as walking and cycling, is ensuring the future health of those workers. The hospital, which is the largest employer of healthcare workers in our city, should be a role model for workplace wellness and keeping their workforce healthy. It could be a leader in getting cars off the roads, which ultimately improves the health of the environment and all of us. The disparities in health that exist in the neighborhoods downtown are the highest in the LHIN. As identified by the Erie St. Clair Integrated Health Service Plan, the key areas in Windsor with a high concentration of social deprivation that require attention are Windsor West and Windsor City Centre. This is where we have high rates of people living below the low-income cutoff, high unemployment rates, higher utilization of hospital and longer lengths of stay due to higher incidences of chronic disease and mental health disorders. Why would we remove their access to emergency service and health care? Yes, there is a plan for an urgent care center and a mental health center in the core, but urgent care centers and walk-in and discharge centers. Patients will still need to be transported to the County Road 42 site if they need to be admitted to the hospital. How will their family or friends get to them if there are no bus services? And yes, Windsor taxpayers will probably have to come up with money to expand transit service to County Road 42, but this is money that could have been used to improve existing service if an urban site were chosen. As mentioned before, the closest geographic example of a hospital choosing not to abandon its most vulnerable is the Henry Ford Hospital in Detroit. They chose to build beside the existing hospital to serve the people who needed the health care services the most. I'm amazed at the transformation of Detroit that has occurred in the 8 years that I've lived here. They are reusing, refurbishing, and rebuilding while Windsor is taking the opposite route. I was appalled at the number of empty buildings and wide open fields within the city when I first came to Windsor. However, even though so many neighborhoods have empty buildings, there's so much opportunity here. It has real estate and a cost of living that is so low that it is possible for small businesses to start up, and it is possible for people to be creative here. I was and still am absolutely enamored by Windsor and its potential. If we want to attract people to take advantage of Windsor's many strengths, we need to support urban intensification, which in turn supports the health of our community. Ignoring the principles of urban planning and health impact assessment that are supported by the World Health Organization, the Centre for Disease Control, Health Canada, the provincial policy statement, and Windsor's own official plan amounts to bad public policy. Unfortunately, the selection of the County Road 42 site for our hospital will negatively impact our community for generations to come, and I cannot support the tax levy to fund this plan. Thank you.